What's up, sunshine? It's time to shine this Thursday, November 30th. It's a Random Thought Thursday, so think about this. Nothing is on fire. Fire is on things, and fire trucks are really water trucks. Happy Friday Eve. I'm Coy Wire. Welcome to CNN 10, where I tell you the what, letting you decide what to think. We start today with news out of China, where hospitals in Beijing and the northern part of the country are reporting a surge in respiratory illnesses in children. But Chinese officials are telling the World Health Organization there's no need to worry, saying it's just typical seasonal infections causing the spike. It's not any new or unknown disease-carrying pathogen. During this rise in respiratory illnesses, the WHO is advising people in China to do what they can do to reduce the spread of infectious disease by staying at home when they're sick, wearing a mask when it's appropriate, and using good hand hygiene. The WHO is not recommending that travelers change their plans or take any particular precautions when visiting China other than to avoid travel if they're sick. Here's our Ivan Watson with more.
Long lines of patients at crowded Chinese hospitals. A warning from the World Health Organization about an upsurge of respiratory illnesses among children in northern China. And administrators from several pediatric hospitals in and around the Chinese capital saying the spike in patients exceeded their capacity. Should people be worried?
I don't think they should be too worried because we have to look at a number of factors. So the first is that is winter and it's cold, and wherever you have this, you're going to be getting an increase in respiratory infections.
The WHO says, according to Chinese government data, there's been an increase of RSV, adenovirus, and influenza since October, and an uptick of mycoplasma pneumonia since May, but not a novel pathogen like COVID-19. Chinese health officials reported the increases to the WHO, but are downplaying the severity of this strain of pneumonia, which the WHO says can be treated with antibiotics.
So far, there is just zero evidence that there is a new virus being circulating in Beijing or elsewhere.
The global COVID-19 pandemic first appeared to originate in the Chinese city of Wuhan in late 2019. Critics accused the Chinese government at the time of not being transparent about what later became a global health crisis. Long after the rest of the world moved on from social distancing, Beijing maintained strict COVID restrictions. Epidemiologists say the surge in illness now is China playing catch-up to other countries.
What we are seeing is what's actually been seen in many other countries before, is that after COVID, is that when kids get together, there will be an increase in respiratory viruses.
But the increase is putting real pressure on some Chinese hospitals, where doctors say patients have to wait hours to get an appointment.
Every night, we have doctors from different departments working overtime, and each doctor will take at least 30 online consultation sessions per night.
Due to China's relatively underdeveloped primary care system, hospital emergency rooms often serve as the first point of contact for patients with even mild illness. So during flu season in China, scenes like this aren't unusual. Even when they're sick and receiving an IV drip, children are expected to do their homework. Health officials are urging parents not to rush their kids to children's hospitals in China's first winter since COVID.
More health-related news now, this time from New Zealand, which was on track to be the first country in the world to prevent an entire next generation from smoking. The anti-smoking law, which was scheduled to take effect 7 months from now, banned sales of tobacco to anyone born after 2008. But New Zealand's new government called it off. Here's our McKenna Ewan with the why.
New Zealand was on track to have the world's leading smoking ban, but the nation's new government plans to scrap it.
Both New Zealand First and the ACT Party were insistent that they wanted those regulations reversed, and we've agreed to that.
Smoking is the leading cause of preventable deaths in New Zealand. In 2022, the previous government passed legislation that would make the country first in the world to outlaw smoking for the next generation, barring sales to anyone born after 2008. The policy was praised by public health officials around the world, and months later, the United Kingdom announced a similar plan.
My government will introduce legislation to create a smoke-free generation.
That same month, New Zealand held elections that led to a new, more conservative coalition government. So why does the new government say it's reversing course? Well, money. A leader in the ACT Party, one of the coalition parties that make up the new government, said that New Zealand brings in about $1.8 billion in tax revenue from tobacco every year.
The government can continue to tax it, and I think that's a more realistic solution than what the previous government was headed toward.
Others in the government, including the Prime Minister Christopher Luxon, also suggest that reversing the ban prevents a black market for tobacco from forming. Health models suggest that the ban could have saved up to 5,000 lives each year. Public health officials aren't happy with the change.
That was a world-leading policy that was going to save thousands and thousands of lives. So it feels a tremendous cost to be in power to give up that bill, because it's just going to prolong the death and the disease that's been caused by smoked tobacco.
The ban was set to go into effect in July 2024.
10-second trivia. What helps create the atmospheric phenomenon Aurora Borealis, also known as the Northern Lights? The moon, the tides, the seasons, or the sun? If you said the sun, put your hands up. Aurora Borealis is an atmospheric phenomenon caused by particles emitted in solar storms, creating enchanting waves of colored light. All right, we want you to take a look at something that looks a lot like the Northern Lights, but it's actually something unique. Meet Steve, a rare spectacle that hovers over the horizon in the Northern Hemisphere. It's a bit different from the more famous auroras we're familiar with. Those shine blue, green, and red when charged particles from the sun interact with our atmosphere. But old Steve is caused by an atmospheric river of particles heating up, and it shows up at lower latitudes as streaks of purple with distinct green bands. All right, so why do they call it Steve? Well, members of the Alberta Aurora Chasers in Canada borrowed the name from DreamWorks' 2006 animated movie Over the Hedge. When the characters encountered a surprise, they named it Steve to make the discovery less scary. All right, we often talk about on this show how if you want to make something happen in this world, you have to see it up here in your mind's eye before you can see it out there in the world. Well, today's story, getting a 10 out of 10, is about a woman named Brooke Hart-Jones who took a dream and made it a reality.
As a little girl, Brooke Hart-Jones loved dolls. As a young lady, she attended an HBCU. And as a grown woman, 3 years ago, she decided to get an old classmate a gift.
I was looking for an HBCU doll to gift someone during the pandemic and couldn't find it. And I was shocked. And I'm like, surely these exist.
But dolls representing students at historically black colleges and universities did not exist. So the Dallas toy buyer, furloughed by her company during COVID, decided to make some herself.
And so that's how it came about.
Brooke handmade them. Her husband packaged them, and they sent them to the few folks who bought them. Now, they are sold everywhere. Target, Walmart, Sam's Club, Amazon. Young black girls all over the country are buying and loving them. The 11 HBCU dolls have different skin tones and hair textures.
What is that? You your daddy?
But they also have different interests. Autumn is a majorette and business major. Nicole is homecoming queen and pre-med.
They all have positions of leadership and unique backgrounds.
Notice the dolls Brooke had as a little girl? They did not look like her. The ones she's making now not only look like the girls who get them.
It is the opportunity to plant the seed of higher learning, teach about HBCUs,
but also show them what they can achieve.
You going to a HBCU too?
They see themselves. They see what they can be, what they can achieve, what they can become.
That was awesome. To all my goal getters out there, remember, complacency is the constant enemy. NBA legend Kobe Bryant once said, the most important thing is to try and inspire people so that they can be great in whatever they want to do. Shout out time now to the superstars at Star Iva Middle School in the town of Star, South Carolina. Put the in Tigers and dominate this day. And shout out to the Mountain Lions at Meadowee Community School in West Paulette, Vermont. We'd be lying if we said we don't have mad love for y'all. Much love and many blessings to all of you. Thank you for your energy, for spending part of your day with us. I'm Coy. I'll see you tomorrow. Peace out.